In this lecture, we will talk about the effect of adding saline solution to the extracellular fluid, and we will discuss the effect of basically different types of saline solution like isotonic saline solution, hypertonic saline solution, and hypertonic saline solution. And we will see that when we add the solution to the extracellular fluid, what will be its effect on the extracellular fluid and the intracellular fluid, what will be its effect on the volume and the osmolarity. Now, suppose for example, this is the normal human body. This is the normal human body, and in the normal state, we have not added any fluid. This is a person with normal state, 70 kg weight, and exactly normal health. Now, in normal human beings, in a normal person, the osmolarity of the fluids, the osmolarity of the body fluids is around 300. The osmolarity of the body fluids is around 300. And the volume of the body fluids is around 40 liters. Around 40 liters. Majority of the body fluid is basically intracellular. Majority of the body fluids are intracellular, and some of the fluid is basically extracellular, which is basically composed of the interstitial fluid and the plasma. Now, this normal condition is something which we have discussed previously in the last few lectures in detail. So, in normal human beings, in normal conditions, normal state, osmolarity is around 300, and the body, the volume of the fluid is around 40 liter. Most of the fluid is intracellular inside the cells, and some of the fluid is outside the cell in the interstitial fluid and the plasma. Now, we will see that what happens if we add different types of solution. First of all, we will add the isotonic saline. Isotonic saline. Now, isotonic saline is a saline with osmolarity of 0.9. Osmolarity of around 0.9. Now, 0.9 is the normal osmolarity of normal body fluids. Is the osmolarity of normal body fluids. If we add saline to the extracellular fluid, and normally we add fluids to the extracellular fluid, we cannot directly put fluids into the cell. If we drink water, the water basically goes into our stomach, and from the stomach it goes into the intestine. From the intestine it is absorbed into the plasma, and the plasma is basically an extracellular fluid, and from the plasma it may go into the interstitial fluid, and from there it will go into the intracellular region, but it will directly go into the extracellular fluid. From the intestine, the water will be absorbed into the plasma in the blood, and it is an extracellular fluid. Similarly, if the fluid is basically injected, if it is injected, it directly goes into the blood, so that is also an extracellular fluid. So we basically we add the saline solution to the extracellular fluid, and it basically initially directly goes into the extracellular fluid. Now, if the osmolarity of the fluid is normal, or it is isotonic, iso means the same, and its tonicity is the same, it will not basically cause any increase in the increase or decrease in the water level of the cells. So what happens is that the only change that will occur is that there will be an increase in the extracellular fluid. There will be an increase in the extracellular fluid. Nothing else will happen. The osmolarity will remain the same. There will be no change in osmolarity, and there will be no change in the intracellular fluid, because we discussed previously in detail that if we put isotonic fluid, we put a cell in the isotonic fluid, there is no change basically. If we put a cell in the hypotonic fluid, then fluid enters into the cell due to the osmosis, and if we put a cell in the hypertonic fluid, then fluid goes out of the cell due to osmosis. So the cell shrinks here in the hypertonic, and cell basically water enters in the if hypotonic fluid is given. So these are the things which we basically discussed, and now we are basically applying those definitions and those rules which we discussed. So by adding isotonic fluid, there is only addition of extra fluid into the extracellular fluid. In this yellow region, more fluid is added, no difference occurs. Now, even in this patient, if this is a normal adult person with addition of some extra fluid, even this extra fluid will go out of the body through urine or other mechanisms. If the person is in absolutely normal health and is not in the fluid, the isotonic fluid is given in a small amount. Now, what happens if we add hypotonic saline solution into the body? If we add hypotonic fluid into the body, what will happen is that due to addition of hypotonic fluid, suppose for example the body fluid is 0.9, and we basically add a hypotonic fluid which is basically 0.5. So initially what happens is that initially only the extracellular fluid will increase. Initially, only the extracellular fluid will increase, and its osmolarity will also decrease from this region to this level. Its osmolarity from this 300 level, it will fall down to this level. You see, there is a fall in the osmolarity, and we see that if in this normal 0.9% body fluid we have added this 0.5% hypotonic saline, the end may be or for example if it gets diluted, the total osmolarity will decrease due to this 0.5%, and it may become either 0.7 or something 8. So the osmolarity has basically dropped down. The osmolarity has basically dropped down from 0.9 to around 0.7. For example, just an example, you see there is a decrease in the osmolarity, and this fluid initially will increase the extracellular fluid. It will increase the extracellular fluid, but after some time some of this fluid will go inside the cells as well, and it will also increase the intracellular fluid. So the effect of adding the isotonic fluid to the body was just increase in the extracellular fluid, nothing else. No change in the osmolarity and no change in the intracellular fluid volume. But by adding hypotonic saline, the tonicity of the fluid is basically lower than the normal body osmolarity, so it brings down the osmolarity. It basically brings down the osmolarity from this level to this level. It brings down the osmolarity, and it distributes evenly. Because initially it distributes in the extracellular fluid, but some of this fluid then goes into the intracellular fluid as well. Now here we consider that the cell membrane is basically not allowing the movement of sodium and chloride. Now sodium chloride are not moving here and there, only movement of water is occurring. So if the sodium chloride in the intracellular fluid remains the same and they cannot cross the cell membrane, and extra fluid has been added, now that fluid will basically start entering the cells. So it will definitely increase the volume of fluid. It will basically increase the volume of fluid from this region to this region. Now here, if the body fluid volume was 40 liter, here it has now basically increased to around 43 or 44 or whatever amount of this hypotonic fluid may be added. But the effect is that it will increase the intracellular as well as the extracellular fluid volume. Both the volumes will increase, and the osmolarity of both will decrease due to this low tonic or hypotonic fluid. Now it is obvious that if we add a hypotonic fluid to this fluid, it is definitely going to bring down the osmolarity, so the osmolarity will decrease. And as the sodium is not moving outside the cell membrane, so only water is allowed to move. Now the amount of sodium chloride, the ions inside the cell remains the same. They become concentrated as compared to the fluid outside. So fluid start moving into the cells. Fluid from outside starts moving into the cell. Initially, they only increase the volume outside or the extracellular fluid volume, but slowly and gradually the water starts moving into the cell as well. So it increases the intracellular fluid volume as well, and the total volume increases more than 40 liters. It may increase to 42, 44, or depending upon the amount of fluid added. Now, what happens if we add a hypertonic fluid to the extracellular fluid? If we add hypertonic saline, suppose for example we have a normal body fluid 0.9, but we add a 2%. If we add 2%, so the average may become something like 1.2 or 1.3. Now this is normal, and this is the hypertonic. Here 0.9% was normal, and the hypotonic was less than 0.9, which was around 0.5. Here we are adding 2% or 3% or 4% saline. So basically the fluid, the tonicity of the fluid is higher than the normal tonicity, which is 0.9. So the average increases. So by adding the hypertonic saline, the tonicity, the osmolarity basically increases from this level. That osmolarity increases from this level. In hypotonic fluid, the osmolarity basically decreased. It decreased, but in hypertonic saline, the osmolarity increased. The osmolarity of both the extracellular and the intracellular fluid increased. But there is one difference. We added this hypertonic saline to the extracellular fluid, as we discussed previously, that initially the fluid is added to the extracellular compartment. So initially there is increase in the volume. There is increase in the volume of extracellular fluid, and as the fluid added outside is higher in tonicity, now the water from the cells start moving outside toward the hypertonic fluid. Suppose for example, as we discussed previously, that if this is a hypertonic fluid, this is normal cell, this is a hypertonic fluid, we see that the tonicity of this fluid is higher than the fluid inside the cell. So fluid inside the cell, the water inside the cell will start moving outside, and the size of the cell will shrink. In hypotonic fluid, basically what happened is that the fluid started entering inside. Here in hypertonic, the water from the cell is basically going outside. So the water from the intracellular compartment is going towards the extracellular compartment. So this extracellular compartment has decreased this much. It has decreased this much. Now the intracellular compartment has decreased from this level to this level, and the extracellular compartment has basically increased from this level to this level. Here in hypotonic saline, there was an increase in both the extracellular and the intracellular fluid. But by addition of hypertonic saline, there is increase only in the extracellular fluid, because water from the cells is basically leaving, and it is also going towards the extracellular fluid, and basically this is an attempt of the cells to neutralize and to obtain the osmotic equilibrium. The cells are basically trying to obtain this osmotic equilibrium, so this fluid from this inside the cells is also going outside towards the extracellular fluid. So there is increase only in the extracellular fluid, and there is rather a decrease is occurring in the intracellular fluid, and the tonicity of both the fluid basically increases. So there is an increase in the osmolarity. Now to summarize it again, in a normal human being, in normal health, the osmolarity of the body fluids is around 300. The total volume is around 40 liters. If isotonic fluid is added, there will be only increase in the extracellular fluid, and no other change will occur. If hypotonic saline is added, if there is addition of hypotonic saline, we see that there is movement of fluid inside the cells. There is movement of fluids inside the cells. So there is increase in size of the intracellular fluid. There is increase in size of the intracellular fluid as well as the extracellular fluid, and overall there is a decrease in the osmolarity of the intracellular and extracellular compartments. Both the osmolarity of both the compartments decreases because of the addition of hypotonic fluid. And if there is addition of hypertonic saline, then there is movement of water from cell towards the fluid, and there is decrease in the size of the water inside the cell. So what happens that the intracellular fluid compartment decreases, and there is increase in the extracellular fluid compartment only, and the osmolarity of both the intracellular and extracellular compartment basically increases. Here in the hypotonic saline addition, the osmolarity of both the compartment basically decreased. So that's basically an application of these osmotic equilibrium and these different types of saline solutions, which we discussed previously. So to properly understand, you must watch this lecture as well, in which we have discussed these terminologies, and you must also watch the remaining lectures on osmosis, in which we have explained that why the water is basically moving from a region in which the concentration of water is high, and it is moving towards a region where the concentration of water is low, and basically it is moving towards a region where the concentration of solute is high. So that's all about the addition of different types of saline to the extracellular fluids, and the effects of adding different types of fluids on the volume of intracellular and extracellular fluid, as well as the effect on the osmolarity of both the intracellular and extracellular fluid. Thanks a lot for watching the video.